Hey mamas, I'm Brooke Miller, registered dietitian, certified lactation counselor, and a mama who has helped hundreds of moms feel like themselves again after baby, boost their energy, mood, metabolism, and even milk supply. Inside of the Postpartum Shift podcast, you'll learn how to take care of your health so that you can show up best for the ones you care about most. Each week, we'll tackle topics like nutrition, exercise, breastfeeding, mental health, and so much more. Plus, you'll get access to guest experts who will share ways to make your pregnancy and postpartum experience easier. Whether you're approaching the postpartum period or you're right in the thick of it, you're in the right place. Let's dive into today's topic. I'm guessing you've probably heard of Ozempic, Mounjaro, Wegovy, all of these different semaglutides, and I've been getting a lot of questions from moms wondering, should I try one of these out? And I'm going to be diving into the pros and cons, who these medications are right for, who should avoid these medications, and all of the things. So first things first, I think that there's a lot of shame around wanting to go on one of these medications. And I hear a lot of people shaming women who do it and say, oh, you're taking the easy way out, you're lazy, yada, yada, yada. I also hear people saying, these medications are meant for people with type 2 diabetes, and now that they are not getting access to them because other people are taking them for weight loss. So I think there's definitely some shame and stigma around it. I think there's also some black and white thinking where there's a lot of healthcare practitioners, dietitians out there, or people who say you should never take it, black and white. There's too many side effects. You should never go on it. And so I'm going to be kind of talking all about my opinion on it. Again, this is totally my opinion. But let's dive in. So first and foremost, these medications are not recommended if you are trying to get pregnant, if you are currently pregnant, if you are breastfeeding. So if you are in any of those phases of life, I would absolutely recommend that you do not go on these medications. If you are considering trying to conceive in the next year or two, if you want to maybe have another child, I also would not recommend going on these medications, because what ends up happening is you could be on this medication, and then if you're trying to get pregnant, you're going to have to go off of this medication. And this medication does mess with some of your hormones and your metabolism. So we do not want to be messing with these things during these different seasons of life. So that is just my personal opinion. However, there is a lot of research that says if you are breastfeeding, if you're pregnant, we do not recommend being on these medications. So I think it would be really, really tough to find a doctor or physician that would recommend it during this time. I've also talked to different moms who are like, okay, well, I want to go on this medication. And I'm just going to wean from breastfeeding so that I can go on it because I want to lose the baby weight. And so that is something else that I wanted to talk about in this episode. So in my personal opinion, I would not recommend going that route of I'm just going to wean earlier than I wanted to with breastfeeding so that I can get on this medication. And here's a big reason why. You could potentially wean from breastfeeding, go on this medication, and then you could end up having some of the common side effects like nausea, vomiting, diarrhea, and you could be so sick that you end up wanting to get off of the medication, and now you're upset that you weaned from breastfeeding when you couldn't even tolerate being on this medication in the first place. So my recommendation is always, breastfeed as long as you want to, as long as your intention is, as long as your goal is, do what you can to reach whatever goal you have set. So you may set the goal to breastfeed for 1 week, for 1 month, for 1 year, for 2 years, whatever your goal may be. I am here to support you in reaching that goal. And I would not personally recommend changing your breastfeeding goal just to get on this medication. Now, what ends up happening is these semaglutide medications, it activates our GLP-1, which is a glucagon-like peptide 1 receptor to increase insulin secretion. And then this suppresses our glucagon secretion and it slows gastric emptying. So all that to say, this medication is there to help support your blood sugar hormones. So think insulin and glucagon. These are your blood sugar regulated hormones. And it is true. If your blood sugar is off balance for whatever reason, especially chronically, weight gain is a very common side effect. And so for a lot of women, if they're wanting to lose weight and their blood sugar is off balance, just focusing on ways to get your blood sugar in balance typically does lead to weight loss. And so my first recommendation as a dietitian is let's try to do this through diet and through lifestyle changes first. Let's not jump to medications that have a lot of side effects as our first line of defense. Now, I'm not saying that I would never recommend this medication to anyone, but I am saying as a dietitian, let's first look at things that do not have any side effects. So starting to balance our blood sugar through getting more protein on our plate, through consistent meal timing, through going for walks, through exercise. These are not going to have any negative implications on your health. They're not going to mess with any type of medications you're on. So as a dietitian, that is always my first recommendation is let's find ways through stress, through exercise, through nutrition to regulate our blood sugar naturally first. Okay. So if I work with a mom and if let's say she has been doing this, she's been following the protocol, she has been exercising, weightlifting, she is getting enough protein on her plate, she's eating super consistently, she is balancing her blood sugar with the right balance of protein, carbs with fiber, and fats on her plate. And she is doing this for a while and her other labs look good, but for some reason her blood sugar is still not looking good and her hemoglobin A1C is still high despite doing all of these things and managing it, especially if she's managed it for a while, if she's been done breastfeeding for a while and those hormones have regulated, if she's knows for sure she's done having kids, then in that situation for that mom, I may say, okay, we've tried everything this way. She may be a good candidate for this medication to try because she's already tried all of the lifestyle changes for a while. She's done breastfeeding. She's done, weaning. So she's given her body a long chance to regulate. And again, I'm not talking about let's just try to change our lifestyle and diet for 1 month and, it didn't work. I'm talking about let's try these things long-term for a year or more. Let's be sure that we're done having kids, that we're not going to be breastfeeding or getting pregnant anytime soon. In those situations for women who still are not able to maintain their blood sugar specifically, these medications can be beneficial. Now, I will also say a lot of research shows that if you get on this medication and you're on it for, let's say, 2 years, and then you decide you want to wean off, if you have not implemented any of these lifestyle changes that I just talked about, and all of a sudden you wean off, the likelihood that you are going to gain all of this weight back and more is pretty high. Now, if a mom, again, does these diet and lifestyle changes for a full year and she's still extremely consistent with this and she does go on this medication and she doesn't have any side effects and she stays on this medication for a few years and then she decides to wean off, as long as she's continued with a lot of these habits long term, there is potential that she could continue staying at whatever her healthiest weight is. There is some research to show that if you are doing those things, if you're eating enough protein specifically, if you are weightlifting, you can reduce some of the lost muscle mass that does happen. Now, with any drastic weight loss, whether it's through these medications or whether you're starving yourself or going on something super restrictive, whenever there's drastic, very quick weight loss, we are likely to also lose muscle mass in the process. And that is not something that we want to lose. We want to hang on to all of our lean muscle mass. We want to gain and maintain lean muscle mass. So that is something that we don't want. And so in general, that is why when it comes to weight loss, my recommendation is always let's go for something slow and sustainable, something that is not going to mess with your hormones and metabolism. Let's not lose weight in a way that means we're just dropping water weight and we're dropping a lot of muscle. That is not what we want. So if you are losing weight in a slower and more sustainable way, you're more likely to actually lose fat mass and hang on to lean muscle tissue. And so in general, that is one of the side effects that can happen with this medication is sometimes people lose weight very quickly, but what they end up losing is a lot of muscle mass. And that's really hard. It does take time to gain that back. And a lot of women, when they go on these medications, they get a lot of nausea, vomiting, diarrhea. And so they're having a really difficult time meeting their protein intake. And if you are nauseous all the time and you're not feeling good, it's also going to be harder to exercise. And so I'm not going to pretend that there are not side effects. So the most common side effects with these medications are your appetite is decreased, burping, constipation, diarrhea, dizziness, fatigue, gastrointestinal discomfort, bloating, gastrointestinal disorders. We can have too low of blood sugar, so hypoglycemia. And I have had, actually, if you go back and listen to my blood sugar episode, I would highly recommend that you go back and listen to that episode. In that episode, I talk about how I did my 3-hour glucose tolerance test for my third pregnancy. And I actually ended up going into a hypoglycemic state. My blood sugar got in the 50s. I was sweating. My heart was racing. I felt like I was going to pass out. It is not a good feeling to be in a hypoglycemic state. Some other common things are nausea and vomiting. And so if you go on this medication and you're like, yeah, I'm losing weight, but it's because I'm vomiting and because I can't eat any foods and I feel like crap, that is not something that we want to stay on long term. And actually, we just had a family get together, and my husband was talking to some of his relatives, and somebody in our family just recently went on one of these medications, and she's like, yeah, I'm actually in the process of weaning off because the nausea and diarrhea, like all of these symptoms have been so bad that I cannot tolerate being on it. So this is a very common side effect. Of course, there are some even more substantial side effects that can happen. So some things that have also happened to women who have taken it is a bowel obstruction. Now, this could mean you're in the ICU with surgery. Gallstone attacks. This may mean that you need to get your gallbladder removed. Gastroparesis. This is when your food has a really hard time emptying from your stomach, and so it can slow down or stop. Pancreatitis. This is inflammation in the pancreas. So just from a standpoint, there are a lot of side effects. And there are some serious side effects. These, of course, the really serious ones are not as common, but there are side effects nonetheless. There are even acute kidney issues that can happen, gallbladder disorders, and then there are some rare types of cancer that if they run in your family, this medication is not recommended because it can actually cause some things like thyroid C-cell tumors. So we can't look past these medications. And also, with the risks of these medications can also mess with different medications that you are on. So of course, just like taking any type of medication, we also have to look at what other medications are you on, because we don't want to be taking something that would interfere with something else that you are on. So just from a standpoint of women who are, breastfeeding, especially if we are delaying gastric emptying, if we're reducing appetite, especially with semaglutides, this can actually decrease milk supply. This can also mess with our prolactin and oxytocin levels, because prolactin and oxytocin release are linked with the emptying of our small intestine and our stomach. So if we are not eating enough, especially protein or calories, this can decrease our milk production. Something else that can happen is dehydration if we're not feeling well or if we're vomiting. And then in general, if a mom is breastfeeding and she's struggling regulating her blood sugar hormones with a lot of these diet and lifestyle changes, and she's doing all of these things, then there are some other options like metformin and insulin, because these are safe while breastfeeding. And of course, we always want to look at the lifestyle changes. If you've been wanting to reach your healthiest weight and feel like yourself again postpartum without having to sacrifice your favorite foods or your milk supply, I've got a free workshop just for you. Inside of this free workshop, you'll discover how to boost energy, mood, metabolism, and even protect your milk supply. You'll learn common mistakes that moms make that actually cause exhaustion, mood swings, low milk supply, and weight loss resistance to become worse, things that moms don't even realize. And you'll learn the proven 3-step method to heal your hormones and metabolism after baby, so you can go from surviving to thriving postpartum. Plus, as a free gift, you'll get my postpartum snack guide when you come hang out with us. All you have to do is click the link in the show notes to save your seat today. Spots are limited. See you there. So I hope that this gives you a different perspective, and I don't think it's black and white. I don't think that these medications should never be used. I think that there are some people that if they've tried a lot of other things and their blood sugar is still not managed long-term, despite trying some of these other things, I do think that there can be patients where this medication is beneficial for. I do not think that people should jump on this medication without changing lifestyle habits, because again, if you ever decide you want to wean off this medication and you have not changed anything in your lifestyle, the likelihood that you will gain more weight back than when you started is very high. And in general, it's not good for our bodies to weight cycle, to drop and gain really drastically. The other thing we have to consider is you are risking potentially losing some muscle mass. Now, there are some studies that show that not every single person is losing a ton of muscle mass. So there are some studies that show people with type 2 diabetes specifically who go on this medication and who are still eating enough protein and exercising, they did not necessarily lose a drastic amount of muscle mass. They did lose some because, of course, whenever we're losing especially a large amount of weight, some of that will be muscle mass and then some of it will be fat mass. And so that is something to consider. So in general, I don't think people should feel shame or stigma about going on it. I also don't think that this medication is right for everyone. I don't think that breastfeeding moms should actively wean just solely for this reason, to just jump on this medication. I 100% do not think if you are considering trying to conceive, if you are considering having other kids, if you're considering getting pregnant again in the future, if you are currently pregnant or breastfeeding, I do not 100% do not think that you should get on this medication. It is just not meant for this cycle of life. And again, I don't think that you should feel shame if you are considering going on it, but we really need to weigh all of the risks, all of the pros and all of the cons. And this medication is not meant to be a quick fix. It is not meant to be, I'm going to continue, eating inconsistently. I'm going to continue not exercising. I'm going to continue things that are not necessarily working for your lifestyle, and then just hope that this kind of solves all of my issues. Because at the end of the day, just because we lose weight does not necessarily mean that we are getting healthier. Now, for a lot of people, if we are, let's say we are sedentary, we are only eating processed foods, we're not eating fruits and vegetables, we're not eating, enough protein, our blood sugar is really inconsistent. Now, if we are that type of mom and we start to change these lifestyle changes, we start exercising, we start walking, we start strength training, we start balancing our blood sugar and managing our stress, and we see weight loss as a side effect, it's a side effect. It does not mean that that weight loss caused us to be healthier, but the likelihood that we're going to see improvements in our lab values, our energy, our mood, binges and cravings, the likelihood that we're going to see improvements in all of those things, including weight loss as a side effect, is very high. However, if we don't change anything with our lifestyle, if we are that type of person where we are currently in a season of life where we're not exercising, we are only eating processed foods, and we decide, I'm just going to go on this medication, we may see weight loss. We likely will see weight loss, but that doesn't necessarily mean that we're going to see improvements with all of our lab values. We likely will see improvements with our hemoglobin A1C and our glucose. That likely will happen, but that doesn't necessarily mean that we're going to see improvements with other lab values. It doesn't necessarily mean that we're going to see better energy, better mood. And so just because we lose weight does not necessarily mean that we're going to see improvements with other areas of our health. So weight loss in and of itself does not mean that we are getting healthier. Now, in some cases, again, when it is a side effect of changing our habits, it can absolutely mean that. Just like, if somebody with cancer is losing weight because they have a cancer diagnosis, that does not mean that they are getting healthier just because they are losing weight. Same thing with weight gain. There are some women who are, severely underweight for a lot of different reasons. There are women who are maybe at a normal weight and they're actually malnourished. They're not meeting their nutrient needs. So they're exhausted, they're depleted. They, can't keep up with their kids. They can't lift their kids. So just because you're at a normal weight, quote unquote, doesn't necessarily mean that you are actually at your healthiest state as well. And so there are other women that I've worked with where they actually need to gain some muscle. They need to actually replenish with a lot of lost vitamins and minerals so that they can have better energy, so that they can have the endurance and stamina to keep up with their kids and the strength to keep up with their kids. And sometimes that means that they're gaining weight. Does that mean that they're just gaining only fat? No, not at all. But a lot of women actually do need to gain some muscle mass to get to their healthiest state. And so that is why I do not love the scale as the end all be all. I think the scale can give us some data. It can sometimes tell us if something is going on internally. It can give us some signs or symptoms. Hey, I need to look into this. I need to run some labs. I need to do some dig a little bit deeper into what's going on. So I don't think we should ever throw weight out and say it's just not important at all. We should never look at it. But I 100% believe to my core that there are more important things that we can be looking at when it comes to our health. What is your energy doing? How often are you binging or having cravings? Is your hair or nails or skin, what are those things doing? We can look at our lab values, our blood pressure, our glucose. There are so many other things that we can be looking at that is going to give us a much better indicator of where we are at with our health. So I hope this clears up some questions that maybe you've had about semaglutides. I do think that we're going to be continuing to hear more and more people going on them. And so I think that this is a topic that we absolutely need to talk about. But again, at the end of the day, as a registered dietitian, what I want for all women is I just want women to feel their best mentally and physically. I want you to be strong so you can carry your kids. I want you to nourish your body in a way so you're not depleted. I want you to have good energy and stable mood. I want you to feel confident in your body. And so for a lot of you women out there, that just means we have to make some lifestyle changes with our nutrition, with our exercise, with our stress, with our sleep. And for a small percentage of women who are already making those changes and they've done that and they know they're done having kids, that may mean that for a subset of women, that may mean that this medication may be part of your lifestyle. I am not a big believer in, using medications when it's not medically necessary. So 100%, I think that there is a time, a place, a season where a lot of us need to be on medications. So I am not like, we should never go on medications. Truthfully, like if I have a really strong, severe headache, I will go take an Excedrin because it helps. So I am not the type of person to say that we should never use medications. I'm also not the type of person to say that if we have any symptom, we should just jump to medication as a very first resort, because sometimes a lot of medications have side effects. And then if we have a side effect from a medication, that may mean now we're having to turn to another medication to handle that side effect. And then that may just mean, okay, now this medication interacts with this medication. And so when we start adding medications to things, we just have to realize that there are some risks for side effects. There are some risks that this could, mess with other medications. And so again, that's with any medication that we have to weigh the pros and cons. Just like when a woman comes to me and she has postpartum depression, I am never against medications for treatment. Absolutely. I am never against therapy for treating postpartum depression. But I always come at the standpoint of, let's fill in the gaps with nutrition. Let's make sure that we are not depleted. Let's make sure that, if we're super deficient in vitamin D or iron, that's not going to help our postpartum depression symptoms. So let's first fill in the gaps with those. And then absolutely, if we still need medications for this season, absolutely, let's do it. Let's try some medications. If we still need therapy on top of that, absolutely, let's do it. But I always want to look at any type of symptom or diagnosis from a whole body, holistic approach. How can we come at this with nutrition first? Because again, changing our diet and lifestyle does not come with negative side effects. Eating more fruits and vegetables, increasing protein, drinking more water, going to bed early, exercising, like these do not have any negative implications for our health. So let's turn to those things first because there are no risks. And then if we need to introduce some medications, then we can at least feel really empowered and informed with our decisions with turning to those medications. So I hope this was helpful. Send me a DM if you are considering being on this medication. If you have gone on this medication and you did have any, good or bad experiences, I want to hear from you because I have heard a whole list. I've heard from women who have loved it. I've heard from women who've tried these medications and they've had some really negative side effects and had to wean off. So I would love to hear from you, Mama, and I will see you in the next episode. Exercise is crucial for our overall mental and physical health, especially during pregnancy and postpartum. Something that has helped me stay really consistent with strength training and yoga at home during nap time is the Expecting and Empowered workout app. I love that I can choose how many weeks pregnant or postpartum I am, and the app tells me exactly what to do. Plus, there's cardio, yoga, and strength training options for new moms and moms to be. You can go ahead and click the link in the show notes to get 7 days free and also save 15% off the annual option when you use promo code Nutrition for Mamas. Thank you so much for hanging out with me and listening to the Postpartum Shift podcast. If you enjoyed this episode, it would mean the world to me if you could share this episode with a mom friend and leave a written review. This helps the podcast reach and help even more moms. Come say hi over on Instagram at Nutrition for Mamas.